Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board-certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. I would like to personally invite you to my upcoming live interactive webinar, New Year Jumpstart, 5 Daily Habits to Reach Your Health Goals this year. This free virtual event will be held on Tuesday, January 17th, 2023 at 7:30 p.m. Eastern. If you are ready to kick off your new year with a positive foot forward in achieving your health goals, then you won't want to miss this event. You can find out more and register today at essenceofhealth.link/new-year-jumpstart. This information will also be located in the show notes, so take a look and sign up today. In today's episode, I'll be spilling the tea on the connection between what we put on our plate and the pain we experience. As with all of the information given on the Essence of Health Tea Time podcast, this information is for informational purposes only and not to be used for diagnosing nor treating any health condition. I do recommend you see your personal doctor for proper evaluation and treatment of your personal health concerns. Now, get this tea. This is the time of year when more individuals are ramping up on their amount and frequency of exercise. Whether it be you are wanting to accomplish a new health goal, lose weight, or accomplish a fitness goal, chances are exercise will be involved. And for some, this will lead to inflammation, pain, and possibly injury if not done properly or with the right regimen. And for others, they live with chronic pain and inflammation on a daily basis. So let's chat today about inflammation and how the foods we consume may be contributing to the pain we experience. The Centers for Disease Control, or CDC, reports that 24% of all adults, or 58.5 million people, have arthritis. It is a leading cause of work disability, with annual costs for medical care and lost earnings of $303.5 billion with a B dollars each year. The most common form of arthritis is osteoarthritis. However, some other conditions causing pain and joint inflammation include rheumatoid arthritis, gout, and lupus. So let's break these inflammatory conditions down a bit further. Rheumatoid arthritis, or RA, is an autoimmune disease in which your immune system attacks itself, causing inflammation, pain, and swelling of one's joints and causing damage to other organs within the body. RA commonly affects the joints of the hands, wrists, and knees, causing pain and deformities of the affected body parts. You may be at increased risk for RA if you are a smoker, have a family member with RA, are challenged with chronic obesity, were exposed to smoke as a young child, are of biologically female gender, have never given birth, or increasing age, with rheumatoid arthritis commonly diagnosed in individuals over the age of 60. Those with RA can develop lifelong pain, early onset of heart disease, and chronic joint deformities. Lupus is also an autoimmune disease in which your immune system attacks itself, causing muscle pain, joint pain, as well as a variety of other symptoms, in that lupus affects multiple organs of the body. Those with lupus can be prone to the development of anemia, life-threatening blood clots, chronic kidney damage, fatigue, and many other conditions. For individuals with lupus, they may or may not develop swelling when experiencing pain and swelling in the muscles and joints. However, joint pain is one of the most common symptoms reported by individuals with lupus. There are different types of lupus, with systemic lupus erythematosus, or SLE, being the most common type. It is estimated that over 200,000 Americans have SLE. While lupus can affect anyone, you may be at increased risk for SLE if you are biologically female, since 90% of individuals with lupus are female within the age range of 15 years old to 44 years old. One of the key goals of the Essence of Health Tea Time podcast is to bring awareness and education to the public regarding disparities in healthcare and health conditions. When we are aware of these disparities, we become equipped with the knowledge to promote change. With this in mind, you are also at increased risk for SLE if you are African American, in that African American women have 3 times the increased risk for developing lupus when compared to white women. Studies have also shown that African American lupus patients are more likely to have a more severe form of this disease with multiple organ system involvement, more rapidly progressive disease, and lower levels of social support compared with white lupus patients. Women of color were also found to develop lupus at a younger age, have more health complications related to lupus, and have higher rates of death from these health complications when compared to white women. Let's talk about gout. Gout is an inflammatory arthritis condition caused by a buildup of uric acid in the body. The body makes uric acid as a byproduct from breaking down certain foods that are consumed. Gout typically causes pain in one joint at a time, often affecting the big toe joint, but can also commonly affect other toe joints, ankles, and knees. Individuals will typically experience swelling, extreme joint pain, increased warmth or heat and redness of the affected joint. Gout affects over 9 million Americans, so it is very common. But you may be at increased risk for the development of gout if you are biologically male gender, are challenged with chronic obesity, have chronic health conditions, including congestive heart failure, high blood pressure, diabetes, insulin resistance, metabolic syndrome, or decreased kidney function, which would affect your body's ability to properly filter out uric acid from the body. You may also be at an increased risk for the development of gout if you take certain medications like water pills, drink beer or other alcohol-based beverages, eat or drink sugary food or beverages, or eat foods that are considered to be purine rich, in that uric acid is a byproduct from breaking down purine. Purine rich foods include red meat like beef, lamb, venison, pork, and goat. Purine-rich meat foods also include organ meats like the liver, heart, brain, or intestines of an animal, including foods like chicken liver, beef liver, cow tongue, tripe, and chitterlings. Other purine-rich foods include seafood, including shrimp, crab legs, lobster, oysters, shellfish, scallops, anchovies, sardines, and mussels. Let's talk about osteoarthritis. Osteoarthritis is the most common form of arthritis, affecting over 32.5 million American adults and over 242 million people worldwide. In the United States, this condition also spreads light on a healthcare disparity, with Native American Indian populations being the greatest affected racial ethnic group by osteoarthritis. This condition is caused by wear and tear, breakdown, and damage of cartilage and joints. Individuals affected by osteoarthritis will experience pain, swelling, stiffness, and a decreased range of motion or lack of flexibility in their joints. Because this condition is chronic, it can lead to depressed mood, poor quality sleep, lack of mobility, and affect one's ability to enjoy the quality of their life. It is a frequent contributor to disability and can affect an individual's ability to manage other health conditions like diabetes and high blood pressure due to the medications used to manage pain and the limitations to one's mobility impacting one's ability to get routine exercise. Studies show that 1/3 of people with osteoarthritis have 5 or more chronic health conditions. And osteoarthritis can increase one's risk of heart disease by 50%. Yes, you heard that correctly. Osteoarthritis can increase your risk for heart disease by 50%. You may be at increased risk for the development of osteoarthritis if you are biologically female gender, with women being more likely to develop osteoarthritis than men. You may be at increased risk for the development of osteoarthritis if you are 45 years old or older. Have someone else in your family who is affected by osteoarthritis? Have frequent injuries to your joints from repetitive stress damage or overuse? Or if you are challenged with chronic obesity, in that excess weight places more stress on one's joints, particularly the knees and hip joints. Now that you are aware of the common types of arthritic inflammatory conditions, let me serve you this tea regarding the importance of what you consume and its effect on inflammation within your body. If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. Although some of the conditions we discuss are autoimmune conditions, in the case of rheumatoid arthritis or lupus, other conditions are not, like gout and osteoarthritis. But one common theme for all of these conditions is that flares of pain and inflammation can be reduced with physical activity, weight loss, and a healthy diet. As we often discuss on the Essence of Health Tea Time podcast, food can be used to promote health or used to promote disease. It's up to us to decide. A 2022 study published in the American Journal of Lifestyle Medicine that evaluated individuals with rheumatoid arthritis found that when these individuals consumed a plant-based diet over just 4 short weeks, they experienced less flares of joint pain and swelling. Other studies on osteoarthritis have shown that those who consume more fruits and vegetables have less symptoms experienced due to the phytochemicals in these plant foods that work as natural anti-inflammatories. Here are 10 tips for building your personal anti-inflammatory plate. 1, eat multiple servings per day of fruits and vegetables. 2, eat at least 2 cups of dark leafy green vegetables per day and multiple servings of beets per week to get those anti-inflammatory phytochemicals that we discuss. One product I like to use is called Beet Boost. It contains the extract from beets, tart cherries, and oranges. I often add it to a smoothie to help power me through endurance training and help me with muscle and joint recovery after a workout. I'll place a link for it in the show notes. 3, opt for fruits, including cherries, strawberries, raspberries, blueberries, blackberries, and other red and purple fruits, which have a natural anti-inflammatory effect from the pigment called anthocyanins that is found in these particular fruits. 4, eat beans, 1/2 cup, 2 to 3 times a week. Beans are loaded with fiber, protein, and anti-inflammatory compounds that naturally reduce inflammatory markers within the body. And because beans are high in fiber, they can aid in weight loss, which is also helpful in reducing inflammation and lowering one's risk for these inflammatory conditions. 5, limit nightshade vegetables. Nightshade vegetables include eggplant, tomatoes, red bell peppers, and potatoes. There are mixed reviews regarding if these vegetables contribute to flares of arthritis. For some, however, they may contribute to pain flares. If you're starting on an elimination diet to improve your arthritis, Just start by avoiding these particular vegetables. Then you can try slowly reintroducing them into your diet individually to see if they may cause flares of pain for you. 6, avoid fatty meats, including red meat and organ meats. As we previously discussed, these foods increase inflammatory conditions within the body. They also promote weight gain and cardiovascular disease, further increasing an individual's risk of complications related to their inflammatory condition. 7, avoid sugary foods and drinks. Fructose, commonly found in processed foods and beverages, has been linked to contributing to inflammation within the body. 8, eat omega-3 rich foods like flax seeds, hemp seeds, chia seeds, seaweed, walnuts, and salmon if you consume fish. Omega-3 fatty acids have been shown to be helpful in reducing inflammation in the body. 9, eat unprocessed whole grains like brown rice, oatmeal, and quinoa, which are high in fiber and can help with weight loss and with reducing the risk of these inflammatory conditions, which are increased in individuals affected by chronic obesity. 10, hydrate well with water, not alcohol. Alcohol is often derived from sugar carbohydrates, and the components of alcohol can increase inflammation. Hydrating with water also promotes healthy kidney function, which is important for filtering out those harmful components and toxins within the body that may promote inflammation. The other key component to reducing joint pain is to keep moving. Physical activity has been shown to reduce pain, improve mood, and improve mobility. Choose exercises that won't cause more stress and damage to the joints. Some good exercises for those who may be affected by chronic joint pain include cycling, walking, using an elliptical machine, swimming, or water aerobics. Remember that you are in charge of your health and can make small changes to improve your health and reduce pain. Now let's move into our Ask the Expert segment. In today's Ask the Expert segment, the question that was submitted is, does turmeric help with inflammation? This is a great question and one that has been asked frequently. Now get this orange and spicy tea about turmeric. Turmeric is a spice commonly used in Indian and Asian inspired dishes. It has an orange yellowish color. The main active component of turmeric is curcumin. Some studies have shown that curcumin can have an antioxidant as well as an anti-inflammatory property. Studies have also shown that curcumin can be helpful in reducing flares of pain in those affected by osteoarthritis, rheumatoid arthritis, and gout. However, the problem with many of the supplements on the market is that it is challenging to know how much curcumin is actually in the turmeric supplement. And when curcumin is orally ingested, only a small amount of it actually enters the bloodstream, so one may not be able to physically consume a therapeutic amount. As with any supplement or medication, you should consult with your personal doctor and be evaluated before taking turmeric supplements to reduce inflammation. Some potential adverse effects of turmeric may include bleeding, since it has blood thinning properties, low blood sugar, upset stomach, and ulcers. Turmeric supplements may also interfere with some medications, so be sure to review your supplements with your personal doctor before you start taking them. One of my favorite quotes is, "An ounce of prevention is worth a pound of cure." As we see with inflammatory conditions, with the proper diet, we can prevent the discomfort and complications of these conditions. If you suffer from one of these conditions, think of how good you can feel with less pain. The essence of health is in you. Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@eohwc on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.